Let's begin with the oxygen emergency at the moment. Delhi hospital continued to send in SOS calls for the 7th straight day. Relatives, while they were running from pillar to post to arrange for these oxygens, as well as hospitals clearly said that they can't help it out anymore and that relatives should go and fetch oxygen themselves if they want survival of their patients. Now, oxygen crisis as it emerges, Delhi Chief Minister has asked industrialists now to come in and help, while the Deputy Chief Minister, who's heading the war room and the crisis management when it comes to oxygen, has said that there should also be no false oxygen alarms coming in from various hospitals as well. Here's a report to give you an idea of how bad the oxygen crisis is in the capital.
एक 10 लीटर का सिलेंडर है, वो मैं भरवा के लाया हूँ। मेरा कंधा छिल गया जहाँ से भरवा के लाया हूँ, उठा के। मैं 3 किलोमीटर लाइन लग के पैदल भाग के गया हूँ, तब जाके मेरा वो ऑक्सीजन मिली है।
38-year-old Rajat Ahluwalia's 65-year-old father is battling for life at the Pentamed Hospital in Delhi. But the hospital, with 50 critical patients on oxygen, is running short of the resource, forcing many like him to run around for oxygen and arrange cylinders on their own.
जो ऑक्सीजन की कमी सबसे ज़्यादा हो रही है, तो हमें ऑक्सीजन डेली अरेंज करना पड़ रहा है, खुद हमें लाना पड़ रहा है भरवा के। अस्पताल वाले भी कह रहे हैं कि हम कहाँ से लेकर आएं, क्योंकि उनको भी नहीं मिल रही है और सरकारें पता नहीं क्या कर रही हैं। सरकार अरेंज उनको कराना चाहिए था। आज भाई 3 दिन से आईसीयू के अंदर है, इनकी बहुत ज़्यादा हालत ख़राब है।
ऑलमोस्ट मोर देन 50 पेशेंट्स हैं, जिसमें 10 लोग वेंटिलेटर पे हैं और 10 से 15 लोग ऐसे हैं जिनकी हाई फ्लो पे है, मतलब ऑक्सीजन रिक्वायरमेंट बहुत ज़्यादा है और अगर ऑक्सीजन हमें 1 से 1.5 घंटे के अंदर नहीं मिली तो सिचुएशन बहुत ज़्यादा क्रिटिकल हो जाएगी। वी विल नॉट बी एबल टू सेव देम।
This is the 7th straight day of the oxygen crisis in Delhi's hospitals. The Fortis Escorts Heart Institute received a tanker from the Delhi government today, a day after declaring that it had stopped new admissions and sent out SOS calls for its 100 patients on oxygen support. However, small hospitals like Pentamed scraped through the day on cylinders arranged by staff and relatives of patients.
हमने एक पोर्टल टाइप बनाया है और ऑर्डर जारी कर दिए गए हैं, जिसमें हर 2-2 घंटे में मैन्युफैक्चरर से लेके और अस्पताल तक, एंड यूजर तक, हर एक को 2-2 घंटे के अंदर अपनी ऑक्सीजन की पोजीशन बतानी पड़ेगी।
But Delhi's Deputy CM Manish Sisodia claimed on Twitter that many small hospitals were raising unnecessary alarms about oxygen stock, which was preventing oxygen from reaching hospitals that are actually in need. According to government data, the nationwide oxygen demand has grown 23% in 3 days, while allocation increased by 22%. Tamil Nadu sought 280 metric tons but was allocated 220. Gujarat sought 1000 metric tons but was allocated 975. Haryana sought 180 metric tons but was allocated 162. 19 other states were allocated more than or equal to what they sought. The first oxygen express, carrying 70 tons of oxygen from the Jindal steel plant in Raigad, is expected to reach Delhi Monday night. The PM today assured that all districts will soon have their own oxygen plants. 162 plants are already in progress and 551 more plants have been sanctioned through PM CARES.
Today is the 7th consecutive day that Delhi's hospitals have sent out SOS calls for oxygen. While Delhi government is struggling to deal with this nightmare, it serves as a lesson for all other state governments to ramp up their medical resources while they still have time. In New Delhi with camera person Sanjay Kaushik, this is Sukirti Dwivedi for NDTV.
And helping India in this international crisis of sorts and this oxygen crisis of sorts are now several countries, starting with US, where Joe Biden said that he's determined to help India, and this as India battles a second wave. Now, there also was a conversation that happened between the National Security Advisor Ajit Doval about the spike in the COVID cases in India and to his counterpart in the United States, and they have decided to stay in close touch in the coming days, and the United States stands in solidarity with the people of India, and we are deploying more supplies and resources as well. So that's what's coming in with the conversation that happened between Ajit Doval and his counterpart. Also, the US-India Strategic Partnership Forum says that it has placed orders for 1 lakh portable oxygen concentrators for India. The forum said that they appreciate the efforts by leaders across the United States government at the highest level to identify concrete steps the United States can take to assist India through this crisis. They added that US should include a waiver of current restrictions on the export of vaccine raw material as well to ensure production of vaccines in India can continue uninterrupted. Remember, that had been a real source of a miscommunication in a way, or perhaps a lot of controversy coming out of the lack of any sort of support coming in from the United States. So from US and UK, finally some help coming in. But let's shift our focus to what's happening here in the national capital. Delhi reported 22,933 new cases on Sunday and 350 deaths. Delhi had recorded about 24,000 cases the previous day. Now, while the number of cases has come down slightly, the number of daily tests have also seen a dip. 75,912 tests were conducted in the past 24 hours against over a lakh, which were conducted on the 14th of April. Now, Delhi's positivity rate is over 30% at the moment, and the oxygen crisis across Delhi's hospitals also continues. Several hospitals like the Jaipur Golden Hospital, the Irene Hospital and the Solanki Hospital sent out SOS calls for oxygen even last night. So Kirti Trivedi joins us for the very latest. So Kirti, it's a start of a brand new week, of lockdown as well for the national capital. And while experts have been pointing out that it takes at least about 14 to 15 days to see the impact of lockdown on cases and deaths, what exactly are you hearing from doctors in the capital about how do they see the lockdown impact numbers?
Well, yes, Sonal, you're right. As the other experts say that it could take anywhere up to 14 days for us to see the lockdown impact. A similar thing is being said about the national capital as well. The lockdown has been extended for another week, but for us to see an impact, to see a reduction in the number of daily cases and daily deaths, it might take us still a few more days because while our daily cases were highest at about 28,000, they are at around 22,000 now. Deaths, however, continue to be very high, only a very, very slight dip from the record numbers that were recorded day before yesterday. It was 357, the highest, and now it's 350. So the number of deaths is not seeing any decline at the moment. So Delhi might have to wait a few more days to really know whether this lockdown is having an impact. But definitely for the healthcare workers that are working in hospitals right now, they would definitely say that the lockdown has helped them because they already have so much caseload working day and night that any more patients coming their way would just be something that they would find it impossible to handle.
All right, thanks, Kirti, for that quick update over there as we wait to see more impact of the lockdown actually come down. But we've seen it work in Maharashtra, where we saw a major dipping down of cases and also the positivity rate. But when it comes to the oxygen crisis in the capital, is Delhi government also responsible? Well, that's what the central government is at least suggesting at this point, adding that plans for oxygen plants in Delhi were actually drawn last year, and tenders were given out in October. But Delhi government did not act. Pointing to the proposed oxygen plants in 4 hospitals that would be supported by the PM CARES Fund, sources in the central government said the Delhi government had not done its homework on this front. Sources in the Railway Ministry also said that even now, the Delhi government has not provided the cryogenic tankers for the Oxygen Express, and the Delhi government, in fact, in response to this, quite angry and brushed it off, saying this is outrightly false, given that the centre is trying to hide its abject failure in setting up the PSA oxygen plant here in the capital. Now, owing to the spike in cases, the centre has allowed everyone above 18 to get vaccinated in the 3rd phase of vaccination drive, which begins in a week from now on the 1st of May. However, in the 3rd phase of the vaccination drive, there will be no walk-in registrations. People above, in fact below 45, are required mandatory to register either via the Covid app portal or the Arogya Setu app. Earlier, the second phase of vaccination drive was started. The government had allowed walk-in vaccination facility across the nation. People who had not registered themselves for vaccination could just walk in simply and get the vaccines. That is not going to be the case this time around. And in a virtual address, leading doctors of the country, Dr. Randeep Guleria, Dr. Naresh Trihan, talked in detail about the COVID-19 precautions, symptoms, oxygen saturation, hospitalization and other related issues as India finds itself battling with a grave crisis amid the second deadly wave.
हमें कोई घबराने वाली जरूरत नहीं है, पैनिक की जरूरत नहीं है। और अगर हम सब के सब अगर ये देखें कि हमारी रिपोर्ट पॉजिटिव आ गई और हम एकदम एडमिट हो जाएं या एकदम ऑक्सीजन शुरू कर दें, तो ये बहुत गलत धारणा है और इससे अननेसेसरी ऑक्सीजन की शॉर्टेज हो जाएगी। यूएस के एक स्टडी ने ये शो किया था कि अगर रेमडेसिविर हम मॉडरेट टू सीवियर पेशेंट में, मॉडरेट टू सीवियर, माइल्ड में किसी ने नहीं दिया है, मॉडरेट टू सीवियर में दें तो हॉस्पिटल स्टे कुछ हद तक कम हो जाता है। इसलिए जो स्टेबल पेशेंट्स हैं, जो घर पे हैं, जिनकी ऑक्सीजन सैचुरेशन ठीक है, 94 से अबव है, इन लोगों को रेमडेसिविर की कोई जरूरत नहीं है। और रेमडेसिविर अगर आप लेंगे तो उससे नुकसान ज्यादा हो सकता है, फायदा कम होगा। इसलिए एक बात ये भी मैं कहना चाहूंगा कि रेमडेसिविर कोई मैजिक बुलेट नहीं है।
ये हॉस्पिटल्स में ऑक्सीजन की कमी है, वो इसलिए हुई है कि हिंदुस्तान में जो पहले हमारे हेल्थ केयर की कंजम्पशन थी ऑफ ऑक्सीजन, कोई अबाउट 15 से 2000 टन की थी ऑक्सीजन पर डे। अब हमारी जो वो रिक्वायरमेंट है वो 7-8 हजार तक पहुंच गई है। तो इसीलिए जो मैन्युफैक्चरिंग फैसिलिटी थी जो नॉर्मल हमको सप्लाई करती थी, उनके पास इतनी कैपेसिटी नहीं है। वो पूरा कोशिश कर रहे हैं और उम्मीद है कि आने वाले 5-7 दिन में जो ये तकलीफ हो रही है हॉस्पिटल्स में, लास्ट घंटे 2 घंटे की ऑक्सीजन बचती है तो ऑक्सीजन डिलीवर होती है, वो जो सिचुएशन है मेरे को लगता है अंडर कंट्रोल आ जाएगी। अगर जो आप घर से बाहर जा रहे हैं कहीं क्राउडेड प्लेस में, तो डबल मास्क यूज करें। N95 है तो N95 और एक वो जो उसके ऊपर एक सर्जिकल मास्क, अगर जो नहीं है कॉटन मास्क भी यूज करते हैं तो 2 करें, एक और उसका ऐसे टाई करें कि वो सील बन जाए आपकी फेस के ऊपर। क्यों हम कह रहे हैं और सावधान रहो? बिकॉज ये वेरिएंट की जो स्प्रेडिंग कैपेसिटी है वो डबल हो गई है।
Meanwhile, Director General Health Services Dr. Sunil Kumar claimed that people should not watch too many news reports.
न्यूज वगैरह पर बहुत ज्यादा ध्यान ना दें। देखिए, न्यूज में कई सारी चीजें होती हैं, सेल्फ इंटरेस्ट भी होते हैं, किसी तरह का पैनिक क्रिएट करना होता है। आपने सभी सुना है टीआरपी भी बढ़ाने की कोशिश की जाती है। मैं उन सब चीजों के बारे में नहीं जाना चाहूंगा क्योंकि वो मेरा सब्जेक्ट नहीं है। लेकिन मैं इतना ही कहूंगा, सिलेक्ट न्यूज करें, सिलेक्ट न्यूज सुने और बहुत ज्यादा न्यूज ना सुने। सारे दिन भर न्यूज सुनते रहेंगे, आपका सचमुच में आपका मस्तिष्क जो है वो फटने लगेगा, वो आप स्वस्थ नहीं रह पाएंगे।
All right, moving on now. Maharashtra, that has seen the worst impact of second COVID-19 wave, registered 66,191 cases, marginally lesser than the day before. That saw a record 832 deaths as well. Meanwhile, the state capital Mumbai reported about 5,500 new COVID cases, showing a decline in number of cases again, and the positivity rate also dropping. Last week, it was 18%. At the moment, 13.75%, and the zero positivity stands at 36. And amid a massive surge of COVID-19 cases in India, landmark buildings in the UAE illuminated with the tricolour to show solidarity with the country as it tries to tackle the pandemic.
The third Zero survey in Mumbai has found about 36.3% zero positivity among citizens, which means about 36.3% people have had coronavirus. Zero positivity has gone down in slum areas as compared to last time and gone up in non-slum areas. According to the survey, zero positivity in slum areas has declined to 41.6% from 57% in July and 45% in August. Seropositivity in non-slum areas has increased to 28.5% from 16% in July and 18% in August. These findings match the current trend where more cases are detected from non-slum areas. But the restrictions in place in Mumbai seem to be working, as the number of cases dropped from over 7,000 to below 6,000 in the last 24 hours. Mumbai's positivity also improved from 18% a week ago to 13%, and recovery rate is now above 85%. There could also be good news for those above the age of 18 who become eligible for the vaccine from the 1st of May.
पिछले कैबिनेट में हम लोगों ने चर्चा किया कि महाराष्ट्र में 18 से लेकर 45 साल के उम्र के लोगों को मुफ्त में टीका लगाया जाएगा, और कल ही वित्त मंत्री और उप मुख्यमंत्री अजीत पवार जी ने कहा है कि हम ग्लोबल टेंडर मंगाकर जो अच्छी वैक्सीन होगी, सस्ती होगी, उनसे 14-15 करोड़ वैक्सीन खरीदेंगे और महाराष्ट्र के सभी लोगों को मुफ्त में टीका लगाने का काम करेंगे.
Even though this is a much needed step, the state needs to be prepared and avoid such signs saying vaccine out of stock. With Purva Chitnis in Mumbai, NDTV Bureau Report.
In Ghaziabad, some critical COVID patients are now being provided oxygen by the Khalsa Help International, an NGO. The founder of the organization claims that the healthcare system is crumbling and patients are unable to find beds, oxygen, and they have saved the lives of over 1,200 COVID patients who had critically low oxygen levels with their help.
Right now we are in Ghaziabad of Uttar Pradesh, and tall claims have been made by the governments that as far as the hospitals of Uttar Pradesh are concerned, there is no shortage of oxygen, no shortage of critical healthcare infrastructure at the hospitals of the entire state. But here the situation is entirely different. All of these cars that you see have patients of COVID-19 in them, and Khalsa Help International, just a year-old organization, is providing oxygen support to all of these patients. We have one of the members here of Khalsa Help International. Sir, आपका नाम बताइएगा.
मेरा नाम गुरप्रीत सिंह रमी, फाउंडर खालसा हेल्प एंड प्रेसिडेंट गुरुद्वारा इंदिरापुरम.
सर, क्या हालात इस वक्त यहाँ पर है, क्या आप देख रहे हैं, क्या हालात उत्तर प्रदेश में बने हुए?
शायद हालात का जायजा, यहाँ की सिचुएशन आपने दिखाई होगी, भली बात ही पता चल गया होगा लोगों को. इस टाइम जो हमारे यहाँ पे सरकार है पूरी क्रैश हो चुकी है. हॉस्पिटल की पूरी जो फैसिलिटी है बिल्कुल डंप हो चुकी है. हॉस्पिटल वाले जिनको जवाब दे रहे हैं उन आदमियों को हम यहाँ जिंदा रख रहे हैं. लोग हॉस्पिटल से अपने पेशेंट को लेके यहाँ पे आ रहे हैं, उन लोगों को हम यहाँ ऑक्सीजन प्रोवाइड करा रहे हैं और उनकी ज़िंदगी बचा रहे हैं.
सर जी, एक बात बताइएगा, उत्तर प्रदेश सरकार ने, मुख्यमंत्री ने खुद कहा है कि उत्तर प्रदेश के अस्पतालों में ऑक्सीजन की किसी प्रकार से कोई कमी नहीं है, लेकिन यहाँ पर फिर पेशेंट्स क्यों आ रहे हैं?
सर, सरकार ने जो उनके अपने आश्वासन है, अगर उनके पास कमी नहीं है तो उनको कहो योगी सरकार को या योगी जी को कि प्लीज़ कोई भी टीवी चैनल देखिए, गुरुद्वारा इंदिरापुरम की आप देखिए, यहाँ लोग क्यों सड़कों पे आके बैठे हुए हैं. अगर हॉस्पिटलों में कमी नहीं है तो वहाँ इलाज हो जाता, तो यहाँ लोगों को आने की क्या जरूरत पड़ती. 24 घंटे 3 दिन से 3 रात 3 दिन से चल रहा है. यहाँ पे तकरीबन अभी तक 1000 से 1200 आदमियों को हम जिंदगी दे चुके हैं. इस निशान साहब के नीचे यही वो निशान साहब है जो लोगों को ज़िंदगी बचा रहा है. गुरुद्वारा इंदिरापुरम, जब छोटा गुरुद्वारा जब ऐसे काम कर सकता है तो सर सरकार के हाथ में सब कुछ ही है ना.
बिल्कुल. तो हालात काफ़ी गंभीर है आपके हिसाब से, क्या हालात है?
हालात का ये हाल है कि इस टाइम जो ऑक्सीजन है ये हमारे अपने अफार्ड से है. यहाँ गाजियाबाद में नियर बाय कहीं कोई ऑक्सीजन का प्लांट नहीं चल रहा, या कहीं से हमें सपोर्ट नहीं मिल रहा, ना सरकार से ना प्रशासन से. पर ये समझ लो वाहिगुरु के बंदों ने किसी की जान बचानी है. हमें एक सिलेंडर के लिए 200 किलोमीटर भी जाना पड़ता है, तो हमारी 6 गाड़ियां इसी काम के लिए लगी हुई हैं.
Now let's begin with the numbers in the national capital, which came in last evening. Delhi has reported about 22,933 new cases and about 350 deaths. Now this is a slight decrease from what we saw in numbers the previous day, which were about 24,000 cases, and the number of deaths there also being seen roughly around the same time. But this is also happening when we've seen a dip in the number of testing as well. Testing has gone down from at least 1 lakh the day before to about 75,900 just yesterday. Delhi's positivity rate at the moment continues to be over 30%, an oxygen crisis as well. There's no ending on that front as well. Sukirti Trivedi joins us now. Sukirti, we've seen a lot of back and forth between the Delhi government and the central government over oxygen supply crisis. But as of this morning, how do the hospitals in the capital stand?
Well, Sonal, as far as Delhi's hospitals are concerned, so we are standing outside the Meteor Hospital in Qutub Institutional Area. And here also there were 20 critical patients since last night, and they were facing an oxygen crisis. But for a temporary period, there are oxygen cylinders that have been brought in, and that is how the situation is being handled. Now, even many other smaller hospitals like Jaipur Golden Hospital or the Solanki Hospital or the Irene Hospital, all of these were facing oxygen crisis, and they sent out SOS calls last night to the Delhi government, after which tankers or cylinders were sent by the government to all of these hospitals. At this point, how things are working in Delhi, how they are being managed is that hospitals have an oxygen supply for about 10 to 12 hours, then they send out an SOS and new supplies are brought in. So there are no permanent solutions as of this moment for hospitals across Delhi. Most of these hospitals are getting supplies for only 10 to 12 hours, and then when it's about to finish, an SOS call goes out and then new supplies are brought in, because the system is overburdened at this point of time, and no hospital can be given supplies of 3 to 4 days at one go. So all the hospitals, what the management is trying to do is trying to ensure that all the hospitals are running, all the critical patients everywhere can be managed at least for the next 10 to 12 hours. And when they are about to their supplies are about to finish, then new tankers are sent to them to ensure that no lives are lost. So things really being there are hospitals that would say that they've been saved by a whisker. Many hospitals receive it just before a few minutes. So things are very tricky at this point of time, but the Delhi government says that they are trying their best. Many of their leaders are constantly active on Twitter for any SOS calls going out, and also assuring the public through that medium that we will not let any lives be lost in the national capital. We are here to take care of you. So that's how the Delhi government is managing. There are special portals also being set up to ensure that there are real-time updates of how much supply is being sent from the manufacturer, how much does the hospital have. So all of those coordination systems are also being set up.
Right. So, Kirti, also wanted to get a sense of understanding from you. A lot of people looking at these numbers right now are going to question the lockdown. Say, well, 1 week of lockdown, see the numbers haven't significantly come down. Important to put in perspective over here that it takes at least 14 to 15 days for results to start showing and for the chain of transmission to stop, for cases to actually come down. It has successfully been seen in Maharashtra and Mumbai, and Delhi perhaps this week hoping for some breather.
Well, yes, Sonal. So our record daily cases were around over 28,000. Currently, if you look at the last 24 hours, we had over 22,000 cases. So there is that slight dip there, but we can't call it a trend yet, because like you pointed out, experts would say it would take anywhere up to 14 days for us to say as a conclusion that yes, the lockdown has worked. So because the incubation period of the virus, by the time people start showing symptoms, all of that, there is that 14-day window. Because of that, we will have to wait for a few more days to say that the lockdown in Delhi has worked. But as of this moment, it is definitely a big relief to all the hospital infrastructure and the healthcare workers that are working across the national capital. They are already trying day and night to ensure that the patients that are already inside hospitals are getting the right care, and they are not in a position to deal with any more patient load. And that is exactly what the lockdown is helping them in at this moment.
All right, thanks, Kirti, for joining us for the very latest, but talking about that oxygen crisis. Now, let's bring you some other piece of news now. Is the Delhi government also responsible for the current crisis? Well, that's what the central government sources, at least at the moment, are suggesting, adding that plans for oxygen plants in the national capital were drawn last year and tenders were given out in October, pointing to the proposed oxygen plants in 4 hospitals that would be supported by the PM Care Fund. The central government sources said that the Delhi government had not done its homework on these fronts. Sources in the Railway Ministry also pointed out that even now, the Delhi government has not provided the cryogenic tankers for the Oxygen Express. The Delhi government, obviously extremely angry with this, brushed it off, saying this is outrightly false. And given that the centre is trying to hide its abject failure in setting up the PSA oxygen plants in the capital. All right, so blame game there happening between the centre and the state at a time when we would really love to see more coordination between the two. But let's move on to Mumbai now and Maharashtra. Maharashtra has seen the worst impact of the second wave, 66,191 cases, marginally lesser than the day before, but it saw record deaths as well, 832 deaths. Meanwhile, the state capital, Mumbai, reported about 5,500 new cases, showing a decline in number of cases. Again, the positivity rate dropped, which is good news, from 18% to 13.75%. And as India grapples with a massive oxygen crisis, finally help is coming in from several international fronts. We've got the President of the United States saying that he is ready to assist India in all ways possible, saying just as India sent assistance to the United States as our hospitals were strained earlier in the pandemic, we are determined to help India in this time of need as well. Also, conversations have been happening between India's National Security Advisor Ajit Doval and his US counterpart, and they've been talking about various ways in which the United States can be sending in help to India. This includes supplies and certain resources as well. This also includes the much talked about raw materials for the vaccines. But it's not just the United States, it's the corporates and all of them helping as well. Now, this is what the Microsoft CEO had to say. He said, "I'm heartbroken by the current situation in India. I'm grateful that US government is mobilizing to help. Microsoft will continue to use its voice, resources and technology to aid relief efforts and support the purchase of critical oxygen concentration devices for India." We have Dr. D.K. Baluja from the MD Jaipur Golden Hospital in the capital joining us. We've got from Mumbai, Dr. Kalamath joining us. Dr. Rishi Gupta joins us from the national capital as well. Let me bring in Dr. Baluja at this point. From Dr. Baluja, we've seen a terrible tragedy, sometimes being averted, sometimes being really in the middle of it all, as oxygen crisis is a huge issue now, not just in Delhi, but in other parts of the country as well. First up, just tell us, how are you placed as of this morning?
Madam, what happened the other day, the tragedy took place where we lost 20 precious life. And the 20s are not, madam, just the statistical number. They are all human beings. They were my patients. They were my responsibility. They came on faith of Dr. Baluja and Jaipur Golden Hospital. And where did I put my faith? The government of India, Delhi government, that they will give me the oxygen. I have one of the best infrastructure in Delhi, best doctors, nurses, paramedic staff, ventilators, logistic support, critical care. But what Dr. Baluja doesn't have is oxygen in his hand. And where we failed, the only element which was to be contributed by the government, oxygen. That's the one factor which failed. I feel very sorry for my patient and for myself and how helpless we are feeling. This is absolutely, it is not tolerable. We call ourselves a fifth or sixth largest economic power of the world. This is economic power. I cannot provide oxygen to my patient, just a mere gas oxygen to the patients. That too in the time of need. Some head should roll. What is happening in the country? Where is the management?
When you say heads should roll, what are you indicating?
We have got a written commitment on 22nd of April from the Special Secretary, Ministry of Health and Family Welfare, Delhi government, that Dr. Baluja, Inox will supply you 3.6 metric ton of oxygen without fail 24 hours. This is a written document. We were given our fill on 22nd. The next day, when the field was redue after 24 hours, that was at 5:30 p.m. in the evening. I checked with the Inox people in the afternoon. They said it will reach by 6, 7. We said, fine, we always have 2-3 hours margin with us. But I told them the situation will be critical after that. In the evening, when nothing was happening, the Inox people were untraceable, nobody picking up the phone, then the panic started. I was running here and around oxygen management help cell, helpline, nodal officers, talking to my network, to my friends there. After around 9-10 o'clock, they said we are awaiting some tanker for some kind of a pop-up from All India Institute or from a medical hospital. You know what? The delivery was given to me. It came at around 12 o'clock in the night, and that too I was given 1.5 metric ton. 40% of my quota given to Dr. Baluja after a delay of 7.5 hours. This is a hospital. This is not a Sarkari office where you can wait for 3 hours or 4 hours. A patient has to take breath every 3-4 seconds. And you are asking me to wait for 7 hours?
But Dr. Baluja, completely understand your sentiment right now, or at least you're attempting to at this point, and you are one of those hospitals who's seen a major crisis. Others have managed to avert it at some point or the other. But before I move into the other panelists, I just want to understand this very straight from you. At this point, the Delhi government is saying that they're trying to do everything in their capacity. They've got this coordination committee and who's working 24/7 to try and make ends meet. Oxygen is in acute shortage. What more do you think could have been done?
The steps which Delhi government has taken yesterday, making some senior IAS officer looking into the individual problem of a group of 4 or 5 hospitals, that should have been made on day 1. Day 1 when the order was passed. That these are the people who are designated for you. And it's, madam, making a helpline is very easy. But you tried yourself how many times the phone is lifted. The question is that the response, making a system is very good, but making the system work is, that is where the problem lies. Who will make the system work? Today, the other problem is, it's one factor is short supply. Okay, you take us in confidence. I agreed. My requirement was more than almost 4 metric ton. They said, we give you 3.6. Fine, it's okay, I will manage. But you give me that 3.6. If you cannot give me in one go, be confident, give us assurance. Okay, Dr. Baluja, I will give you every 9 hours. Now, one is the short supply. The second is the uncertainty of the supply, which is killing us. That uncertainty, we cannot plan anything. We are not taking any patient for last 3-4 days. And unfortunately, Sonal, nobody is thinking, I am getting 500 calls a day. Doctor Sahab, hum kahan jaye? Where will we go? People are on the roadside, outside the casualty. Please admit, please admit. It is a community problem. I am worried about, we are talking about by 200 patients and 20 patients who have died. But what about the thousands and tens of thousands of people who are needing admission? Nobody is giving admission to them.
Dr. Baluja, you've been asking some very relevant questions. Sadly, I don't have the answer to that. It is a shame, really, that a national capital is in such acute shortage. And what I shudder to think is, imagine that's happening in the capital. Imagine what's happening in the rest of the country as well. Dr. Rishi Gupta, quick comments, please.
I think what Dr. Baluja pointed out, I think this is the situation all over India. Actually, if you ask me, in Faridabad also, we had the similar situations 2-3 days back, when in my hospital also, almost there was only 3 or 4 hours of oxygen left. And and then we sent the SOS to the authorities. Luckily, within 1 or 2 hours, we could manage. But what I understand, there are many issues. The important issue is that what I understand that the total production of oxygen in the country is almost same
All right, we seem to be losing that line with you. Let's try and fix that line with Dr. Gupta. But I'm not sure if production of oxygen is an issue or transportation of oxygen is an issue. That's something that we need to look at. Let me bring in our guest, Dr. B.C. Kalmat, as well from Mumbai. Dr. Kalmat, at this point, when you're listening to doctors from Delhi and NCR, is that the sentiment that you're feeling in Mumbai as well? At least there we haven't heard of oxygen, such acute oxygen shortage.
Good morning. Yeah, I mean, I agree that this should have been forlooked and planned earlier, but sometimes medical emergencies were so huge that it goes haywire. But luckily in Mumbai, we got some supply from Vizag and Gujarat, and we've been able to scale the. We had the same problem 4, 5 days, 6 days ago, like Dr. Saluja told us, that we even scaled down the oxygen requirements from the patients. We were anticipating we reduced the FiO2 from 60 to 40, but still patients could be alive until the oxygen arrives. Fortunately, in the hospitals where I am working at Bombay Hospital and Jupiter and Horizon, oxygen came very nick on the time, within 4 hours or 3 hours remaining stock, that could save a lot of lives. And I'm sure this planning has to be done, and I really share Dr. Saluja's concerns that it has to be.
You're saying a very important thing. Let me bring back Dr. Baluja here. Dr. Baluja, I hear doctors in other states saying that they're getting help from various other states which have surplus. Kerala, for example, has a surplus. Now it's sending out to Tamil Nadu and Karnataka and other places. Is this then a Delhi-centric problem? Is this that somehow... I ask this because for the past week, every evening between 5 to 7, I've been getting calls of SOS calls from hospitals, and they say that, well, their oxygen tankers are blocked at the borders, blocked at the Haryana border and blocked at the UP border.
This is what I gathered the day the tragedy happened in our hospital. There was some diversion of, normally there is a system, the Inox company send us a dispatch note in the morning.
Okay.
That your quota, like 3.6 ton or 4 ton, has been dispatched from Modinagar or such and such destination, and will reach you by 6 o'clock, 7 o'clock. And generally, we never had this problem, even during this COVID time. Before 22nd April, this is very crucial for us to understand. Till 22nd April, we never ever had even a problem of oxygen at all. We were not even focusing on that, whether we get oxygen or not.
Then what happened?
I mean, we were more into direct patient care.
Right.
But when the system of this 3.6 metric ton of given quota to the government, and the government probably how they dealt with the Inox people and all, it started right from then, the very next day onwards there. And some people from Inox have confided that we are not able to supply that much what the government is asking us to do. So you are telling me, you tell the government your inability to supply for that reason. What I gather, what I feel probably is, see, it is a purely man-management failure. You have a gap in demand and supply. Is it because of loss of less production? Then try to produce production in a shortest manner, like you create it in a day or two, whatever you can, or you make a long-term vision. If you have a problem of operational problem, it's a management problem that at one place you have a surplus oxygen and the other place the people are dying of the oxygen.
Very important things you're saying, Dr. Baluja. Extremely important things. You're saying this is not just a crisis which has come up because of overloading of cases. This is a management issue.
More than management issue, it is the question of honesty and integrity of the institution. Why don't you tell us the truth? Who is coming openly and publicly? Somebody is saying shortage. Delhi government says shortage. Government of India said no shortage. We have given them double the quota they required. Now they said we don't receive. Now between these two fight, I feel I'm like an orphan. One government is my mother and the other government is my father. They have left me orphan. And where do my patient? I am the Bhisham Pitama of my patient. What do I give them the answer? They every day they ask, hey, sir, what is the position of oxygen? Will we able to live to tonight or not? These are the questions being asked to us.
Dr. Baluja, kudos to what you're doing right now and the circumstances under which you and several other doctors are working. We'll have to leave it there, gentlemen, at the moment, but we really hope this reaches the government. If this is a management issue, somebody needs to be held to task at this point. We'll look into all those details through the course of the day, but let's also bring you this video now, which talks about how is the second deadly wave really in the country, leaving no dignity in death as well. In absence of a stretcher, a health worker had to drag a dead body for cremation, and this was in Bihar, Katihar.
They got a year and they wasted it completely on election rallies and all the other stuff. Allahu Akbar. Assalamu alaikum wa rahmatullah. I have money, I have everything, but I can't save my sister. No gas, no oxygen, no bed. Where we can go? Full India is a problem.
Bengal is voting for the 7th time in the longest ever assembly elections any state has ever seen. That too in middle of a second wave of a pandemic that many are calling a tsunami. Now more than 3 lakh infection a day, but Bengal continues to have elections, and there, let's look at the cases there. Last 24 hours, over 15,800 new cases. That is a major hike at this point. And these are just the reported cases. Remember, a huge amount of underreporting also coming in from the state of West Bengal, 57 deaths as well. Now today, talking about elections, 36 constituencies were to go to polls, but only 34 will go now as 2 candidates in Murshidabad district succumbed to COVID. Monitipa Banerjee now joins us for the very latest. Monitipa, now minus a shadow of the virus, this would have been such an exciting phase. But look what we are talking about at the moment. COVID and only COVID.
Well, it's a matter of life and death for many, many people who are confronting the elections at the times of the pandemic. So certainly COVID on top of, people's minds. People are coming in to vote with masks on. There is sanitizer, all the bandobast is in place. But imagine today, on this day, a day after nearly 16,000 people in Bengal caught the virus, some 86 lakh people will be stepping out to vote, to cast their vote. The huge numbers are really, really scary. In Kolkata, for instance, there are 4 key constituencies that are polling. The fate of senior ministers will be decided, but Kolkata is one of the worst affected, with 3,000 plus new infections yesterday. But just to focus on the key issues cropping up today, Bhawanipur goes to the polls in the city. Bhawanipur is the former constituency of Chief Minister Mamata Banerjee, and she will actually be casting her vote over there. Remember, she switched from Bhawanipur to go fight in Nandigram. Several ministers, their fates will be decided today. Shobhandev Chattopadhyay, who is the candidate at Bhawanipur instead of Mamata Banerjee, he was the power minister. There's Subrata Mukherjee, the Panchayat minister. He is from Baliganj, which is where I am. Then there is, of course, several others, including Kolkata's former mayor, Firhad Hakim. He is polling today. His fate will be decided, and this is from the Kolkata port seat. Rashbihari is another prestige Kolkata seat that is going to the polls, voting already. The other districts involved in the elections today, if Shankar could please just show the lines of men and women who are coming in to vote. The other districts that are going to the polls is Malda, Murshidabad, at one time traditionally Congress strongholds, and then there is South Dinajpur, 6 seats over there, and also West Burdwan. Now what is interesting is that this is battleground with battle time. In the last elections in 2019, in the Lok Sabha polls, in this set of seats, the Trinamool and the BJP were neck and neck. Both had about 37% votes, and both were leading in exactly the same number of assembly segments, which is 16 each. So it's a neck and neck fight in these seats that are polling today. There are reports of all kind of sporadic issues cropping up all over. You know, the BJP protesting against Trinamool not allowing their agents to sit. The same complaint is being filed by the Trinamool against the BJP at several places. The oddest situation happened at Malda, where a young man came to vote wearing a t-shirt with Mamata Banerjee's face embossed on his chest, on the t-shirt. And of course there were objections. The security forces sent him home to change his t-shirt. Sporadic complaints of violence, intimidation also coming in. We'll have to see how the day passes today. 34 seats. Worst of all, 2 candidates from Murshidabad, they died before they could actually have the votes cast today.
All right, thanks for that, Monideepa. We also have a reaction coming in from Abhishek Banerjee. Let's listen into that.
It's not about West Bengal. We have seen the second wave and spike in the entire country. But the unfortunate thing is, when we see the sad state of affairs in the country, that despite knowing that a second wave could happen, the leaders, the Prime Minister, the central government should have rolled up their sleeves and, pulled up their socks. They should have been prepared. I think COVID has exposed a crumbling healthcare system, and how the central government is ignored is extremely alarming.
All right, from West Bengal, let's shift our focus to Tamil Nadu now, which is also seeing an escalation in numbers really. The past 24 hours threw up numbers which are extremely shocking. 15,659 new cases only on Sunday. And in Chennai alone, over 4,200 cases reported as well. Active cases stand over 1 lakh. And Sam Daniel is with us for the very latest. Sam.
Thank you, Sonal. That's right. Tamil Nadu has witnessed around 170% hike in active cases over the last 20 days. In April alone, that's a big concern. And Chennai, over the last 24 hours, has recorded 4,206 cases. And overall, Tamil Nadu's tally is 5% more than what was on Saturday. And from today, Sonal, across Tamil Nadu, all shopping complexes, malls, theatres, auditoriums, salons, beauty parlours, swimming pools, all these would remain shut till further orders in a bid to bring down the positive tally. And we'll have to wait and watch how this would pave way for in terms of containing it. There is also criticism that from January, authorities had let loose, particularly to facilitate large-scale campaigns across Tamil Nadu, as Tamil Nadu went to polls on the 2nd of April. And now that they have imposed this kind of restrictions. But authorities say they are still under control, and they are assuring people not to worry, but they are reiterating their appeal to mask up across the state and to ensure wherever people go to maintain social distancing. And private hospitals at the same time also witnessed shortage of remdesivir, the antiviral drug. The Tamil Nadu government has urged the central government to lift the bar, particularly what they call the restrictive orders placed by the states where these are manufactured. Government says they are providing remdesivir to patients in private hospitals on a case-to-case basis. As we speak now, in a short while, Tamil Nadu Chief Minister will also preside over an all-party meeting to take a call on allowing Sterlite copper smelting plant in Tuticorin to reopen to extract oxygen from there. There is widespread opposition, particularly by local communities, that there could be a kind of a ploy by Sterlite, which is facing huge environmental violation allegations to reopen the plant. And authorities again reiterate that although there is demand for beds in private hospitals, they say not all people require hospitalization.
Absolutely.
Whenever someone tests positive, they appeal people to go to the nearest government screening center, where they will assess the condition of each patient and decide whether they would require just home isolation or some time at the corona care centers. And only for severe cases, they say, people would require hospitalization.
Right.
And this way, they hope that there'll be enough space in hospitals for severe cases. Sonal.
Right. In fact, home care getting more and more prominence now, and doing video conferencing with the doctors is what is really helping out a lot of people, as not everybody needs to be hospitalized and not everybody will even get a bed, remember, in these times. But let's look at neighboring Karnataka now, where the numbers again reported over 34,000 new cases in a single day. Bengaluru alone, Maya, reported over 20,700 cases. This is getting to an alarming number now, but still no talk of a lockdown just yet.
There is a cabinet meeting scheduled a little later today, and it is expected that some tougher measures will be announced after this cabinet meeting. No confirmation yet, though, of lockdown, but it is, of course, a possibility. Also, other questions as well as to the vaccination policy for those between 18 and 45, which will, of course, be starting from May the 1st. So announcements expected from that cabinet meet, because the Karnataka government really needs to take action fast, with over 34,000 new cases in the state, over 20,000 new cases in Bengaluru alone. And in Bengaluru, we're talking of over 1.8 lakh active cases. This is the highest across India, huge number of active cases in Bengaluru. And the state positivity rate almost at 20%, at 19.7%. This, of course, means, this huge number means that there is a struggle for ICU beds, for oxygen, although the state insists that there are enough. But there has been a struggle on the ground when it comes to getting ICU beds and oxygen as well. The state just is out of a weekend curfew. There is a weekend curfew in place, in addition to the night curfew across the state until May the 4th. Now, in order to meet the emergency demand of ICU beds, the state government is immediately setting up 2,000 modular ICU beds in order to meet the demand in Bengaluru, and another 2,500 across the state, in a bid to try and get the emergency healthcare, the ICU healthcare, to those who need it the most. The allocation of oxygen to Karnataka has been increased to 802 tons a day. But of course, social media is still full of calls from people desperate for ICU beds, oxygen, medicines. It's a very, very serious situation in Karnataka indeed.
Right. So we wait to see what happens comes out of that cabinet meeting. However, remember, the Prime Minister had said very categorically that he urges states not to implement a lockdown. So at least in the BJP ruled states, we don't know how this is really going to play out and whether or not they will go against the advice of the Prime Minister. But let's see what comes out of this. Going to the north of the country now, Jammu and Kashmir reporting over 2,400 COVID cases, 21 deaths as well just in the past 24 hours. And this is the highest that the state has reported. Srinagar reported about 748 cases alone, and all this coming at a time when the Jammu and Kashmir administration has ordered closures of all public parks. But Nazir, as we've been talking about, they opened up for tourism, and now this has happened. All experts had said that a lot of tourism or any sort of congregation or gathering in the country will lead to a second spike, and we're seeing exactly that play out even in Jammu and Kashmir.
Yeah, exactly. In fact, just a few weeks back, they were celebrating the festival of tulips and asking people to come visit. Even Prime Minister tweeted, asked people to go to Srinagar's tulip garden, which is Asia's largest tulip garden. And so thousands came there. They were coming there every day. Now what we see today is the surge in COVID. Massive second wave, unprecedented. We have 2,400 cases yesterday, 24 hours, 21 deaths as well. And Jammu and Kashmir doesn't have that resources which can cope up with the increasing number. Only good things, silver lining is so far, there's no shortage of oxygen so far. But doctors say fingers crossed. They don't know what happened, the way it is going up. They don't know whether hospitals can actually cope with this, the number. Already beds are full, COVID wards are full. Most of the patients now, they are on oxygen. So that is something which is worrying everybody here. though the connectivity issues, because Jammu and Kashmir doesn't have, doesn't have a all-weather road. It is congested with just one road which gets closed because of rain or the snowfall. That is the reason we don't have that liquefied oxygen doesn't come here. And all hospitals, major hospitals, have their own oxygen plants. But how long and how far they can cope with the rush of the patient. That is the worry for all the people, all the experts and the health officials here. And in fact, the government is saying they are installing 10 more oxygen plants in next few weeks in Jammu and Kashmir. That is something people are hoping that would happen, because there are already some, hospitals who have already their oxygen plants. What is worrying here for everybody that whether these are laborers, tourists, they are still coming to Jammu and Kashmir. And they are not, they're still coming to Jammu and Kashmir. For example, yesterday, 100 laborers, they reached to the valley at a place called Kazigund. They were tested out of 190. 110 turned out to be COVID positive. And that is the worry. If you allow people coming here every day without checks, and because so many people have gone without being tested, and God knows what would happen. And what people are asking, they are saying, even if a person has got the test done, he should be kept in isolation for some time so that this place is saved from this, surge, massive surge. Already there are near 2,400 cases. People are only hoping that there's also some curbs on the religious gatherings as well, because it's a Ramadan month. So there should be some curbs on that as well.
All right. Again, like we said, that's a shocking number. 110 out of 190 laborers actually testing positive. Imagine if they continue to be on that site, how many more people they're going to infect, especially with the new variants, which are said to be so much more infectious and taking on and jumping on people so much faster. Thanks, Nazir, for bringing us up to speed with that. We really hope the government is listening to all these very valid points that you've raised and they do something about it. For the moment, we're going to slip into a quick break. When we come back, we'll take you to the latest on the Oscar red carpet. The latest COVID figures in the country are now out, and India has reported 3,52,991 cases in the past 24 hours. This is another day, another fresh hike for the country. The fifth consecutive day, really, where India has reported over 3 lakh cases. This is the highest since the onset of the pandemic and also the deadliest so far. Why do I say that? But look at the number of deaths over there. 2,812 lives lost in a single day. Sukirti Dwivedi on the phone line with us. Sukirti, it's just not getting any better.
The situation in India continues to be worrying, with, as we can see, all the bigger states, whether it's Maharashtra, which has seen a slight dip, but the national capital situation also continuing to be worrying. And also the fact that our deaths are so high that they are repeatedly now reaching nearly the 3,000 mark, with 2,812 deaths being recorded. And also the consecutive fifth day when over 3 lakh cases have been reported. So both in terms of our COVID cases as well as deaths, India not seeing a respite at this point of time. The central government repeatedly announcing measures that they are taking in terms of ramping up hospital resources like hospital beds or even oxygen supplies. But across the states which are even implementing lockdowns, we may see some time before we can say as a conclusion that lockdowns have actually worked. So India's healthcare infrastructure also crumbling in several states.
Crumbling indeed, and look at the speed at which the cases have gone up. So Kirti, we're looking at some month-wise data now. In January, overall, India reported about 4,79,000 cases. In February, it came to about 3,50,000 cases. In March, 10,25,000. Look at the pace at which we've gone from 3 and 4 lakh to 10 lakh altogether. And then in April, at least the 25th of April, we have 48 lakh 10,000 cases. I mean, this is a phenomenal rise.
Well, absolutely, Sonal. And even if one doesn't look at the month-wise data, which of course is worrying, if we look at even just a spike in the last 7 days, from 19th April to today, we've gone from 2,73,000 cases to 3,49,000 cases. So almost a jump of about 1 lakh cases in the last 7 days alone. If you look at the deaths, we've gone from somewhere 1,600 deaths to 2,700 deaths now. So deaths again increasing by almost 1,000 just within a span of the last 7 days. So whether you look at the bigger picture of month-wise or you look at just the last 7 days, the speed at which both cases and deaths are shooting up is extremely worrying at this point of time. And while the government has been issuing assurances, the numbers are worrying, and also the ground reality where repeatedly SOS calls keep going out from hospitals.
Right, and talking about that 1 week data, we've added about 1 million cases in just the past 72 hours. So that's the speed at which cases are rising in India. And it's not just cases and numbers, at the speed at which people are getting infected. Look at the deaths. This is the speed at which we are losing lives. And well, what are we doing about it? Well, mostly we are trying to deal with just the oxygen crisis at the moment. All right, with that, we're going to take a quick break. We continue to keep a tap on all those worrying numbers in the country at the moment.